The first step is really showing yourself compassion. This can be difficult to talk about. And so, acknowledging that you're deserving of compassion is the first step.
Hello, hello, lovely people. Welcome to my virtual couch. Happy Friday to you all. We are back with Kelsey with part three. And so we are going to be talking about post traumatic stress disorder, also known as PTSD. So I'm going to throw it to you before it's kind of falls in line of what we've been talking about part one and part two, dealing with your childhood trauma, healing your childhood trauma, and PTSD falls in line with it. So before we even delve deep, let's kind of define what PTSD is, but I'll have you introduce yourself, Kelsey, again.
Yes, yes. So for those of us who are joining, and this is the first episode you're seeing, my name is Kelsey Wilson. I'm a licensed clinical social worker. I have an online private practice for women who are dealing with depression, anxiety, burnout, life transition issues, and trauma. And so I'm happy to be here. I serve clients all across the state of Virginia. And so in talking about PTSD today, this is an area that I actually focus on in my practice. So PTSD. Is a mental health disorder that may occur in people who have experienced or witnessed a traumatic event or a series of different traumatic events. Um, and it can impact you emotionally. Over the course of time, someone may have been in, a life-threatening experience that they may have incurred, and that can have an impact on your mental, physical, or social health over time. Uh, PTSD is different than other traumas because it involves a natural disaster, serious accident, or terrorist attack. A lot of veterans may have gone through like a war combat zone and experienced PTSD as a result. Um, Survivors of sexual assault or rape or intimate partner violence or bullying can also encounter PTSD symptoms as a result. And so I'm happy that we're going to be able to talk about this topic today and some common treatments for PTSD as well.
Thank you for that. I'm glad, Kelsey, that you talked about other things in addition to rape and war, because prior to now we know that PTSD doesn't just show up for veterans and rape victims. You mentioned bullying, you mentioned other things. So I'm glad that we're putting it all under that umbrella, right? Any disturbing or traumatic event that has happened. Um, how do you think that PTSD show up in women?
Yes, definitely. So, definitely someone who's experiencing PTSD would need to be meeting that criterion A criteria that we talked about a little bit earlier. That it's in the DSM where you've experienced a life-threatening situation that happened to you or you witnessed it. But for women, it can show up in terms of having negative thoughts or feelings that make life really difficult. Experiencing numbness or feeling emptiness or feeling tension. These are like some symptoms that can kind of show up sometimes for women who are dealing with PTSD.
hmm Yeah, you're right about the avoidance, especially with the car crash. So it's like, I don't want to relive that. So I'm just going to avoid the whole entire incident altogether. Right. Yeah.
Right.
How can somebody handle those things, like handle the flashbacks, the anxiety?
Yes, yes. So there's a couple of different common treatments for PTSD. Cognitive processing therapy is one where it's 12 to 24 sessions of going through what the index trauma was, which is the trauma that triggered the PTSD symptoms with a trained CPT therapist. And that is a intervention that I offer. There's also prolonged exposure therapy. So, kind of going back to or getting exposure to um, whatever the trauma was that led to the PTSD symptoms. Um, there's also EMDR, which is eye movement desensitization and reprocessing therapy, which is another intervention that I offer to my clients. And it involves really identifying what the touchstone memory is, the earliest memory that made you feel distressed or anxious or depressed, or the trauma that you maybe had from childhood, and then clearing targets that are associated with. Uh, those memories that are causing you to feel distressed.
Mhm.
Um, through using eye movements, sounds, or tapping. And a lot of people find that EMDR is really effective. Some people find that group therapy is also helpful because, talking with people who have gone through similar experiences can really be healing. And some
Mhm.
people also benefit from medication management in the process of getting therapy, or they just solely, go and speak with a psychiatrist about medication management. So it really
Mhm.
depends on the person.
Mhm. Yeah, I love tapping techniques. I It's been very effective, and I even teach clients to do it themselves at home,
Oh,
right?
really?
Because it helps them feel a little bit in control, like I'm doing something about it. I've heard this before, which is something has caused me trauma and you want me to expose myself to it. That doesn't make any sense, right? Like, I never want to be near that thing again. I never want to be near, if I have a fear of flying, I never want to even be near airport. But you're saying, we can treat the PTSD by prolonged exposure therapy. So explain that concept of not avoiding the incident and rather exposure as a method of treatment.
Yeah, definitely. So, um, you might gradually build up to it, right? So if someone has a fear of spiders, for instance, you might start with just looking at an image of a spider and then work your way up to maybe watching a video of a spider and then being in the same room as a spider and then the spider getting closer to you and like actually being a little bit closer. And then maybe you might get to the point where you can actually touch the spider, maybe have the spider like sit on your hand. And we're not talking about venomous spiders, of course, but
Mhm.
and so situations like that are where we can use exposure therapy to kind of decrease the fear of the stimuli or whatever it is that you're afraid of. And I like that plain example that you gave as well. Maybe it's just like talking about flying, and then maybe we can go to the airport and kind of test how you're doing, check in with yourself, see how you're doing. And maybe you might do this with your therapist or, kind of gradual exercises building up to being able to get onto a plane and actually take a flight. And a lot of times, you might have people who are afraid of flying and it's actually related to something else.
Mhm.
And it's not just about the flying, but it's about like a lack of sense of control that comes from being on a plane. And so, really talking with a therapist about what it is that's the underlying reason of the fear can be really helpful.
How does PTSD show up in relationships? So I have a partner that may have PTSD, but I don't know that they have PTSD. How might it show up in other areas?
Yeah, so just for starters, PTSD can often have an impact on like connectivity in relationships. So, difficulty with connecting or communicating what's wrong, or experiencing anger or frustration, and anxiety and depression are commonly associated with PTSD. So, I also want people to know that, and that can play a role in managing relationships with romantic partners or like parenting if it's left untreated. So, it's important to get help early on if you notice that yourself or your partner is dealing with PTSD. And we talked about like avoidance earlier. And so sometimes acknowledging that treatment is needed can be a hurdle at first. So just having those honest conversations about needing help can be the first step, and maybe deciding if you want to see a specialist or if you want to start off with doing group therapy and kind of go from there. Could be really a good first step.
Hmm. Yeah, I even as you were talking, I was thinking about a client that she's married and she has a lot of trauma in her history, but her husband doesn't know about it. And they were watching a movie, and a very gruesome scene came up, and it completely triggered her. She had to walk away. She didn't want to watch the rest of the movie, and then they got into this big fight. And the husband's like, What is this all about?" Right? And so I had to kind of explain to both of them that basically she was triggered, right? And then we had to discuss about PTSD and how it shows up in marriage and things like that. So sometimes the triggers show up in the relationship, but the partner may not know the root of it. So really looking at, um is this a trauma response, or am I responding to whatever is happening in the relationship? And sometimes there's shame about it, right? And so how does, like, if a woman has PTSD, has some trauma, how do they talk to their partner about it if they're feeling shameful?
Yeah, so the first step is really showing yourself compassion. This can be difficult to talk about. And so, acknowledging that you're deserving of compassion is the first step. Um, and then recognizing that it's not your identity. This is just something that you're dealing with. And it is treatable. So talking with your partner about how you're dealing with some struggles related to PTSD, here's some of the symptoms, informing them that they should probably also seek out some support in terms of how to navigate. Um, Being in relationship with someone who is dealing with PTSD can be really helpful because knowledge is power. And then in the process, maybe talking with your partner once you do start therapy about how things are going, what you're noticing that's changing about you as you kind of go through treatment, and some improvements that you're making or things that you're struggling with so that they can support you.
Yeah, I really like that a lot. We also know that, PTSD can show up in a form of a panic attack, right? So how does one handle that when they're experiencing an anxiety attack or a panic attack? What would be some strategies, would you say?
Yeah, so doing breathing exercises can really be helpful. So doing box breathing where you're counting in for 4 counts, counting out for 4 counts while you're doing deep breathing can really be helpful. Aromatherapy can also be really helpful. So if you're noticing that you're having a panic attack, trying to like breathe in some scents that'll make you feel relaxed and make you feel calm. Or finding a peaceful spot that brings you calmness can be helpful. And I also like to tell people about the 5, 4, 3, 2, 1 technique, um, which is focusing on 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste, to kind of bring yourself back down to a grounded place can be really helpful.
I like that method a lot. Thank you for sharing. So, Kelsey, I'm really glad that you mentioned that PTSD is treatable. Oftentimes, people feel like this is something that they have to live with. What would you say if somebody's not ready for therapy? Because we're uncovering a lot of yucky stuff, right? In order to treat the PTSD, we've got to uncover these things, and it might be a lot for them. So, is there anything that they can do pre-therapy while they're determining, if they want to do therapy or not? What are some things that, women need to know? Um, what are some tools that they can use prior to coming to therapy?
Yeah, I would say really doing a reflection exercise, writing down what the benefits are that you think that you could gain from seeking treatment can be really helpful because that's totally subjective, right? Like, say you sit down with yourself and you say, I'm noticing that my PTSD symptoms are impacting my ability to connect with my partner. It's impacting my ability to connect with my children. As a result of that, like I'm having difficulty with, going on outings with my family, or not having the best time having conversations with my partner because, you know, um, the panic, the depression, the anxiety, the triggers that I'm experiencing are really causing me to not really have a fulfilling time when I'm going through my day to day. And I know that on the other side of that, I can have peace from those things through
Mhm.
treatment. So really doing that reflection exercise of the pros and cons of starting treatment can really be helpful. Um, and I know that treatment can be an investment. So, really looking into what are the options that I have. Do I want to pursue treatment through my insurance? Do I have employee assistantship program benefits that I can access, or nonprofits that I want to connect to, or private therapy that I want to pursue? There's a lot of different options out there. So, really weighing the pros and cons of what you can gain from going to treatment would really be the biggest piece, because I know that treatment also requires time commitment too. And
Mhm.
so really putting that investment in is going to take time, whether that's weekly therapy or every 2 weeks when you first get started. So those are all
Mhm.
things to think about.
Yeah, yeah, and you gave some really good resources too, so that's great, and I'm gonna put it in the show notes as well. It how do loved ones get support um, to help their significant other or family member with PTSD? What are the supports for the family members or the loved ones?
Yeah, so I would say a lot of private practices offer support groups that you can check out. If you're looking for specific private practices that are accepting new clients, Psychology Today is a great resource. Mental Health Match is also another one that you can go through to find individual therapists who are accepting new patients and also sometimes offer support groups. The Employee Assistantship Program resource that I mentioned previously, you can find that out through calling your insurance, and on the back of your insurance card will have like member services. The number on the back of the card will basically direct you in how you can access employee assistantship program benefits. Some people have maybe 3 to 9 sessions a year. Some people have enough sessions to last an entire year, depending on how frequent you go to therapy. And so that can be a great resource for the individual who's employed with that employer, or individuals in their household are sometimes eligible as well.
Mhm. Speaking about tools, what are your thoughts on acupuncture to treat PTSD?
I'm not super familiar with the acupuncture piece, but have you ever had any clients who have utilized it? And
Yeah, well, I mean, I've had acupuncture myself, but for a different reason. But it seems to be like the trend of, well, it seems to be the trend of acupuncture to treat like panic attacks,
okay,
right? And some people have found it really helpful. The thing for me with acupuncture is that it has to be consistent. So sometimes I've had a few clients that have tried it and found it very helpful. The only thing is that you have to keep going, you know? So like things like community acupuncture, you can pay like a nominal fee, but it's starting to be a trend of, you know, doing acupuncture in addition to therapy. I
okay,
always say therapy should be the first course of action, but because people are like, sometimes I have clients that really don't want to do the medication route, you know, and so they're looking for more holistic measures. So um they've been exploring other methods like acupuncture, things like that.
yeah.
Yeah, so
And I'm glad you brought that up, because a lot of people find that um, really focusing on the holistic model is really important. So doing therapy and making sure you're exercising, doing therapy
mhm,
and making sure you're eating healthy, and getting outside for hikes, and
mhm.
doing all the things that really play a role in being holistically healthy. So I'm glad you mentioned that.
Yeah, and connecting to nature. I also want to say this because we're talking about women and PTSD, right?
Mhm.
And we talked about how PTSD show up in relationships. How do you think PTSD may show up in parenting?
Yeah, definitely. So, kind of like we were talking about earlier in terms of how panic attacks, nightmares, flashbacks kind of are some core symptoms. It can it can impact your sleep, and that can
Mhm,
impact your irritability and, your mood throughout the day. And,
mhm,
as a parent, you're trying to teach your child like emotion regulation skills and how to connect with people and how to have healthy attachments. But if you're in a place where you're feeling depressed, anxious, not sleeping well, that can show up in how you communicate with your kids. And
mhm,
kids can feel that. And so,
mhm,
it can impact the attachment between the parent and the child, if
mhm.
you're experiencing those symptoms and not getting treatment for it.
Yeah, yeah, you know, and you know, as women have multiple roles, you know, different layers. So, you know, not only just in just being like partners or spouses, but like, you know, being parents as well. I'm sure that could affect it, you know. Um, what if somebody does not know that they have PTSD, right? They've had trauma, but then they don't know if they have PTSD or not. Are there any like I don't know, self-assessments or any online tools, you know, like a measure to see like if I have it? Is it on a scale? Is it on a spectrum? What are your thoughts on that?
Yeah, so the PCL5 assessment is a screener that I use in my practice to assess if someone has PTSD or not. And so depending on where a client falls on the PCL5 assessment, will tell me if they are meeting criterion A, whether they've experienced criterion A criteria, where it's like a natural disaster, life-threatening event that happened to you, sexual assault, all of those areas, or if it's a trauma that they experience, but they're not fully meeting the PTSD threshold. And so that screener, I do it with my clients. I send it out as a part of their intake packet.
Mhm.
But you can also you can hop on Google and see if you're able to access that screener to see if you are meeting criteria. But I would really recommend working with a trained uh, professional who can kind of talk you through whether
Mhm.
you're meeting criteria or not. Um, because you want to make sure that it's assessed properly and that you're getting the right treatment for it.
Yeah, I'm glad you mentioned the tool in addition with a clinician because I feel like nowadays with TikTok and social media, I don't know if you ever have clients that come in and they've self-diagnosed themselves, right? And they're like, well, TikTok says I have X, Y, and Z, right? And I'm like, I understand that, but TikTok is not a licensed clinician. We need to sit down and do the skill. So I'm glad that you are adding the piece of, in addition to doing the self-assessment, because you send it to them. So it's not like only clinicians can use it, but you are there to help to interpret it, assess it, guide them, and then formulate a treatment plan for that.
Right, right.
So that's
Mhm.
great. Okay, yeah, awesome. Anything else that you think we need to that people need to know about PTSD and its treatment of it?
Yeah, definitely. I would say for those who don't know, PTSD can play a big role in um, intergenerational trauma. And I know we
Mm,
talked about this in like a previous episode. But if left untreated, it can impact future generations in
mm,
terms of like attachment and connectivity in families. And so I love doing this work because when people identify that they have PTSD through our treatment together, and then they work on managing the symptoms, and the symptoms go in remission. It has a positive impact on the entire family dynamic, and so it's really exciting to see. And I really hope that women who are watching today find some encouragement if they are dealing with PTSD to really get treatment because it can have a really big impact on yourself and also your family.
you're very right. And our goal is to help people to heal so the cycle can be broken. Yeah, yeah. This was a great discussion. Thank you so much, Kelsey. It's always great, talking about these important topics with you. So thank you so much for your time. You are still not accepting clients, right? You're full.
Well, I'm actually gonna be accepting new clients in February of,
Okay.
2024. I'm gonna be rolling out some therapy intensives, which are 3-hour sessions with EMDR and some art therapy, integrated in that.
Wonderful.
So really looking forward to be able to work with some new clients in the new year. And, if you wanna follow me on Instagram, feel free to do so, Kelsey Wilson PLLC, or you can visit my website, kelseywplc.com.
Wonderful. Kelsey's accepting clients in February. Okay, so I'm going to put your information there and they just contact you through either Instagram or your website.
Yes, reach out to me through my contact
Okay.
page on my website. That's the best way to get in contact with me.
Awesome. Thank you so much, Kelsey.
Thank you.